MMT, hip abduction, gluteus medius and gluteus minimus. Assist the patient to the side-lying position with the test leg on top. Place the legs slightly extended beyond the midline. Flex the lower leg for stability. Stand behind the patient. Passively move the patient's hip through abduction. You are not assessing the infield, you are determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to abduct the hip as you observe for any substitutions. Stabilize the patient by maintaining the pelvis in neutral alignment with your hand. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include the leg moving into flexion, utilizing the tensor fascia lata, and external rotation of the hip to recruit the hip flexors and rotation of the pelvis. Watch the pelvis for a hip hike substitution, which approximates the pelvis to the trunk. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient by maintaining the pelvis in neutral with your hand. Place the hand of your other arm across the lateral aspect of the ankle. The force at the ankle should be directed downward toward the floor. Grade 5, normal. The hip abducted to the available range of motion and the patient was able to hold the end position against maximal resistance with no break in the position. If this condition is not met, you must change the application of the force. The hand applying the force is now placed on the lateral thigh, just proximal to the knee to use a short lever. Again, the force is applied downward toward the floor. Grade 4, good. Hip abducted to the available range of motion and the patient was able to hold against maximal resistance with no break in the position. Grade 3, fair. The patient is able to move through all the available range of motion in hip abduction, but is unable to tolerate any resistance. If none of these conditions are met, we must reposition the patient into a gravity-eliminated position. Assist the patient into supine. The gravity-eliminated position of the therapist is to stand on the side of the limb being tested. One hand supports and lifts the leg by holding it under the ankle to raise the leg just enough to decrease friction. The hand offers no resistance, nor should it assist the movement. The other hand palpates the gluteus medius just proximal to the greater trochanter of the femur. Monitor the femur for any substitutions. Watch the pelvis for a hip hike substitution, which approximates the pelvis to the thorax. Ask the patient to attempt to abduct the hip while keeping the hip in 0 degrees of rotation. Grade 2, poor. The patient completes full abduction range of motion in the supine position. Grade 1, trace. There is partial range of motion, or you are able to palpate a contraction of the gluteus medius on the lateral aspect of the hip just above the greater trochanter. Grade 0, no palpable contraction.